calling the Winnebago County Community Mental Health Board meeting to order Wednesday, June 5th, and it's 2 p.m. And at this time, I will take roll call. Mariana Abadi, present. Dr. Copeland,
Present.
Dr. Giardini,
Present.
Dr. Gorski,
Present.
Dick Cooner,
Here.
Margie Lundmark,
Present.
Tim Neighbors, Mohammed Yunus,
Hey,
and Jason Holcomb, and Chelsea and Mark. We welcome all of you. Next on the agenda, before I move on, I just want to make a note that Margie was board member. First meeting is today, and for those that you don't know, the county board appoints our board members. So our board member, Wendy Larson Bennett, who was here at the last meeting, her term was up, and it's up to the county board, and we're delighted to have Margie with us. But I also want to extend my appreciation, and I know the board feels the same way, to Wendy Larson Bennett, who was such an asset and very important person on the board. So I just want to thank her for her time and dedication. She was on our first inaugural board. So thank you, Wendy. If you know, she can see this meeting on YouTube, and hopefully she knows how much we all are going to miss her and appreciate her work. So moving on to public comment, to my knowledge, we do not have anyone that requested public comment. Is that correct? Correct. Okay. And today we have two presentations, and these are for the Accelerator Award. The first one is Rockford Park District. Lori, are you giving the presentation or? Okay, and I'll let you introduce. That's right, and I understand that position well. So, do you want to come up here? You can use the podium. And I am going to ask that you stay to the 10-minute limit if at all possible. And then we want to ask questions and have that period of time. So we would really appreciate it. We'd honor that.
Get to that time or cut myself off. She's my timer. Lori's my timer. She knows very good and very strict. Cut it.
Yes.
Need a giant book.
Well, we'll let you know when we're done.
That's right. So I go down, not up.
Down to progress, yes, slide, yep.
It's a good thing I know what I'm talking about, so you can see very well. Do you mind if I stay here?
Not at all.
Okay, so, well, I'm Jennifer Winberg. I'm the general manager at the new First Family Equine Center at Rockford Park. And here to talk about the Accelerator Award and why we are asking for that award. And down. So, it's not working. That's all right. I'm just trying to figure out that while I continue to talk.
Oh,
So
yeah.
why are we here? Okay, it's really, why are we asking for the Accelerator Award? It's really expansion of access and opportunity. So with that, access means removal of barriers that you all know that we face when working with youth in our community, the barriers that present themselves. And so we're asking for this, and I'll show you why, to remove as many access barriers and provide as much expanded opportunity as we possibly can, because we believe so much in the power of this model of therapy and transformational healing, that we want to remove as much as possible that will get in the way, and to provide every single opportunity within that building that you have helped us create and build, to expanding it all the way out to the community in any way that we can. So just, I gotta go back really quickly. Did I hit that? So I went and did kind of a recap of that. We'll be doing equine assisted learning, equine assisted psychotherapy first, talk a lot about it. But I wanted to, this quote that I found, I can't restate it any better. And it's amazing what a healing effect horses can have on kids, particularly troubled, and I say disadvantaged, that might bridge the gap that a well-intended human just can't do. So we have all these intentions and these models of trying to help, and we have found in our experiences that adding equine to it just transcends the barriers in the process of healing therapy. Individual and group benefits to just, I really, stop there. Really, I added these pictures because I want you to see. So I could go through all the technical benefits. We have reduction of stress, improvement of personal responsibility, greater understanding of social cues, help with behavioral challenges, help with mental illness challenges. But I want you to see the faces of youth that I've worked with so that you can really put a picture to the services that we're providing and some of the outcomes that it provides, because I know it's very hard to see. You see they're smiling. They didn't come that way. They didn't come to the session with the horses that way. They came with the face that a lot of us see as somebody walks in for whether it's therapy, individual, group, or if they're going in for treatment and you have this look of hopelessness. When they come and they've done a session with equine assisted learning or equine assisted psychotherapy, they leave like this. And I think that's the most powerful thing that I can put to the work that we're doing. Yes, do they learn how to challenge behaviors that are negative and learn how to maybe become more productive in their everyday? Do they have an increased sense of hope? Yes. And they have all these things, but the faces are really what I want everybody to see. And then I'm gonna do a small video kind of putting into action so you can actually see what something might look like when they're doing a session. So along with the description of a little bit about what we're doing with the process, you can also see the connection with the horse. So that's one thing that when you walk into a traditional therapeutic session, that connection sometimes just isn't there. There's these expectations that people, that the youth walk in and they know we have expectations. They know that there's some kind of goal that they're supposed to accomplish and that may be overwhelming or they have a barrier to that. The horses help remove that barrier. So you see connection, you see peer interaction that's in a positive, safe environment that maybe some of the youth that are coming up have access to. So I really wanted to just have a little take into what it looks like, because it's hard sometimes to put a picture to what that process looks like. There we go. Really quickly, why horses, we've talked a little bit about it. They connect on a level that other animals don't. They have appropriate boundaries, so they're fantastic at teaching us healthy boundaries and not taking things personally, and also understanding the importance of community. They're able to help our youth learn those things without us trying to go in and tell them, because if they learn it experientially, then it transcends into their lives more effectively. One thing I like to say, and I started talking about it more, was that we talk about really it's difficult to put words to how these animals connect at the level that they do, but we've done some research and it gets down to they're connected, the horses are connected so strongly that their heart rhythms connect with the person within 5 minutes of them working with them. So it's not only emotionally, it's physically, so they're just a powerful tool. And I just really wanted to recap why horses. But we want to talk more about why are we here in our ask for the accelerator. So we asked for the funding, I believe it was $402,000 and some cents. And that was to purchase a passenger van, additional transportation assistance through bus passes and some Uber, and but knowing that the passenger van is going to be something that is really going to remove the barriers more than, say, giving somebody a bus pass. Maybe they're going to show up, maybe they're not, but we'll talk more about that. A converted minivan for small equine mobile programming. So what that is it's a small minivan. We converted it so that small animals can be transported out into the community to places where youth are who absolutely cannot come to the center. There may be people or in a school setting or in a correctional setting or any kind of setting where they're just, it's not gonna happen, we can't get to the facility, so we go to them. And then diversity equine, why is that important? You have a lot of horses that look the same, but the participants that come to us, they don't look the same. So we have bigger horses and whatnot, but we also want to have the opportunity to bring animals into the community. So it's assistance with that if they're smaller, so you can use mini horses, and we have some pictures of what those look like, and mini donkeys, which have the same type of connection, and it helps diversify when people do come to the center. You know, they look different, you have different sizes and whatnot. And then equipment for sessions. So if you looked at some of the sessions, you saw like the hula hoops, and there's all like a broad range of things that we can always add to the elements of resources within the arena when they're working. Why is it important? I think we all know why it's important to remove barriers in transportation, whether you're writing grants or you're working with agencies. Transportation is like the largest barrier that I've ever run into in the 20 years I've worked in social services. And so we want to remove that. We want the resources to purchase a physical passenger van and provide somebody who will be able to go and drive and go pick up the youth in our community who would not have access to get there any other way. We want to reduce the barriers by picking them up to therapeutic change. Like I said when I opened, we do not want youth who cannot access just because they can't get there. Also, increased outreach. We can go out, I mean, it increases your outreach when you can get to everywhere and get to youth who, you know, might not have access another way. This is what the converted minivan would look like. So it actually looks like a mini saw within the minivan, and you can put a ramp. That's what we've outlined that the cost would be, so that we could convert the minivan and go to those places that cannot come and bring youth to where we're at. So it offers the opportunity for educational and therapeutic services to youth. Through outreach, we have youth who have unforgettable experience, and maybe they did come to the facility, but then we want to recap and bring them out after that 8-week session is done, or they could only come for 2 weeks, and then we can bring them. And then you have so many more youth that you or even team members or staff who see what's happening, and so then you open up the opportunity for, you know, continued development of services and collaborations. This is just kind of what I've already talked about around the scope of outreach, but this is where we have previously years ago taken a larger equine and brought it to a park. It's a lot more difficult to do that. You can't bring a big, huge equine or a horse that helps into a school, whereas you can bring the small animals in. So that's what the minivan we're talking about. But this really gives a picture of, you know, these youth were at Davis Park, and maybe they're not going to come to Lockwood Park. Maybe they're not going to be able to get there. So this is just another picture of how we can get out and expand the services of what we're doing at the Equine Center. Diversifying the herd. I talked a little bit about that, but if you can see, it's very hard to, but that little guy up there is about this big, and he can go anywhere. And the only way we can get him there is with that converted minivan. But we can go to schools, we could bring him here for a board meeting, if you would allow us to bring him for a board meeting, you have that interaction. It's interesting, the other thing is that some youth come, and there is power in the fact that, you know, these courses are big and they put you in a situation to work through your fears, but there are people who, that's just not gonna happen. And we wanna work our way up to working with, a large animal. They may just not get there, and so we wanna make sure that we're accessing everybody and giving them opportunity, and maybe that takes a lot of the fear away. We have a lot of people who will come and like, I want that big animal, they see this little tiny one, and they're okay with it. Let's see. So, this is another picture of faces. Is there a way to play that?
I think if you press it down.
I press down. So I know my time is up, so as I wrap up, just giving you a couple pictures of what with the minis and, activities and what they look like, but really just heading back to this, award affords us the opportunity to, again, decrease and hopefully eliminate a lot of the barriers that, our youth are facing by getting them to the facility, but then also getting the facility and the services out to the community who can't make it to the Beachfront Center. So thank you for your time.
Any questions?
Jennifer, thank you for your presentation, and your passion always shines through, so thank you for that as well. My question, the larger van is how many passengers?
It's 15 or 16.
15 or 16. My question is the impetus behind that reactive, meaning you've already seen in your experience young people who can't get to you or have been able to get to you and subsequently can't return because they don't have a way to come back? Or is it proactive, meaning you realize there's areas of the community you haven't been able to reach? So reactive and proactive, what's driving the reason for that?
Okay, so I would actually say both. I would say both because in my experience across, all the years that I worked with youth in different capacities, that was always a huge barrier, was getting people to where they needed to be. And so as we were developing this and we're developing all of the programming, effective approach to avoiding having people saying, hey, we can't get there, we can't come, and also conversations that I've already had with organizations where transportation is our biggest thing. How are we going to get them there? How are we going to get them there? And then so somebody will come up with Uber passes. Well, can we get 10 youth there every week by Uber passes? Are they going to use them? So in some situations, individual therapy, yeah, that may work better, but when you're talking about the big groups and it's really important to get there each time, that's where that band comes in. So both.
Thank you.
Yes.
Jennifer is very good. I think the Park District I wish our community knew all the things that it does, because our park district is pretty special.
Yeah.
It has a lot of great things, and this program too. Some of us were there for the groundbreaking last year, which I thought was, well attended. I just got a couple of questions. How many are in your program? How many kids in the program, or adults, or,
So we haven't opened yet, we just finished construction.
okay?
So we're developing our contracts, and we have several organizations with youth who are standing by for us getting ready to open. So, the projected number for a full year of programming we have is just under 1,000. I think we projected like 930 some at that point.
That many people.
Yeah, so you can do large groups, there's a variety of ways of doing it. You have individual, then you have therapy groups, which is around 8 to 10 youth. But then we have the opportunity, if groups can't come for an 8-week session, where you can do a large horsepower is what we potentially will call it, where you can have 30 youth or 40 and move them throughout the facility, because we built it in such a way that we can accommodate many youth at one time in different areas. So we don't have a number exactly, but we have so many people waiting. So that's why we're rushing through trying to get this open.
You say you're gonna take this to the schools. How is that gonna be received? How are you gonna work that in? How is that gonna be, what are your objectives?
So that's a process where, and I can't give you, I'm gonna just say a definite answer of how easy that's going to be. I know previously, before coming to the park district, there were some limitations. That was like 15 years ago now. And with the social emotional learning and broadening the idea to be able to reach people, I think we're not going to find as many barriers as we encountered before, but it's developing the relationships. We have some schools that are alternative that we would start with, and then working through the relationship we have with the Rockford Public Schools already that has been developed in creating that. And it's, I think it transcends schools to other organizations as well, but that is really one of the primary things that we're going to be working on.
Could you tell us, this is not in the accelerator, but could you tell us, like, you use a lot of training from Elgin.
Okay.
You want to explain, would you share some information about, like, what you're finding with that program and how it helps you?
Training from Elgin. We use a lot of training from Equine Assisted Growth Learning Association.
Yeah.
So they do it in Elgin. We also, been in Texas, and we just had our team out in Nevada. So it is the overseeing certified agency. And so as far as answering the question, what we found from them is that, and why we're doing what we're doing. So having worked with EGALA for the last 17 years, it has provided concrete evidence that this is working, because they have facilities all the way up, like, to Israel. So all the way across the country, it's just that we've been slower in our area to do that. So the park district now, this is a huge project and huge for our community, because now we're talking about Northern Illinois and serving our community in such a big way. So they are actually, we have some professionals coming from EGALA that will continue to be involved with our training with our team. We have something coming up in like 2 weeks where we're coming, 2 of the top professionals in the country coming to work with us, so that our team is working at top notch and has that experience from them as well. Did that answer your question? Okay.
Okay, thank you so
Thank
much.
you.
We appreciate it.
Thank you.
Okay, moving on to our next presentation, Stepping Stone to Rockford, Steve Schroeder, CEO of Stepping Stone.
This is getting pulled up. My PowerPoint's not nearly as fancy, and this is the second one I've ever done, so bear with it, please. So, for those of you that don't know me, I'm Sue Schroeder, I'm the CEO of Stepping Stones, and for our accelerator grant, we are asking for help in purchasing a new building that will be utilized as our administrative headquarters, and it will greatly expand access for our clinical services that now take place at the main office. When we moved into the building in 1991, we had 7 staff in the building. We now have 32. We kind of jokingly talk when we talk about hiring a new administrative staff, which you have to have in order to keep your accreditation. The more clients we serve, the more people we need in our billing office, those types of things. We talk about instead of own beds, we're gonna get 12 desks to make room for people. We had an architect in the building trying to help us look at it to see if we can better utilize the space. They know where the stairway is and the way the building is built, that it's not an easy thing to do. And then on top of that, our boiler is very, very old on its very last leg. And we have been given a quote to replace the boiler that is more than the building is valued at. So we're, you know, weighing the pros and cons of finding someplace else versus staying where we're at. So this is the hallway on our administrative floor. Initially, I was just gonna send you pictures, and then I thought that probably isn't super helpful. So this is the hallway on the administrative floor. Some of the offices you can see are open, some are closed. All of our administrative staff are there with the exception of my office, and it is on the floor where you walk in. The building's kind of a triangle for those that haven't been in the building before. This is our one group room. We do a lot of group services, and this is the one group room that we have. Groups that we run are things like stress management, coping skills, learning how to better deal with symptoms, relaxation. We're currently running an LGBTQ+. We're running some family groups. So we do groups here as well as at our counseling center. And because of the lack of space, we do some at our residential sites. This is our second group room, otherwise known as a kitchen. Because we just don't have the space, and we have a lot of people who want to do groups. So we have taken over our kitchen to use as a second office space. We ask that they don't run groups between 12 and 1, so people can get in and heat up lunches and access the fridge, that type of thing. If staff get tied up in a meeting or don't make it, I've got a microwave in my office, and that's where people come to heat up their lunch if they miss it in the second group room. We decided, we had put in an application to the board to do an intensive outreach. And the board chose not to fund it, saying it was a duplication of services. We chose to start that program anyway, because of the number of referrals we were getting from people who really needed that level of care. So we built out, we took 2 offices, turned them into 1, built a team space. So that's what you're seeing here. This is where that team works that does our community support services and that intensive outreach. And it is a team space, so for the most part, it works pretty good. Except we don't have any more office space if somebody needs to meet with the client individually, or you know, a client comes and says, I just need to talk, but there's other people in the office. So we're really out of space for that. And we've already reached the maximum number of participants we can have in that program. And we've got more that we believe would benefit from those services. We just don't have room to put another team-based service where we're currently at. This is our nurse's office. We also use it as our telepsychiatry room. When we do what we call clinic, which is when a client comes in to meet with the prescriber, we do it as a team. So in clinic is the client, the nurse, the master's level clinician that works with the client's case manager, oftentimes a counselor or a family member. So as you can see, it's pretty tight in there to do that type of service. That's what we have. This is one of the offices that one of our group leaders uses. He's also our director for the Stars of Light. And so this is where we store all of the equipment and everything that the Stars of Light uses. It's an interesting office. If you're ever looking for fun little props or whatever, we'll take you to Steve's office because he's got some great stuff in there. And this is the hallway in the lower office, so we've got, on the lower floor, you can see we've got offices on both sides. The one thing about this floor is there are no windows. It's dark, but we make do, and we've made do since 1991. When we were talking about our boiler failing and really being out of space, we started to look for another building. So we have found this building that is the former Road Ranger building. It's at the entrance to Rockford University, on the left side. And we believe that it will meet our needs for both administrative space as well as greatly expanding clinical space. The top floor that you see there, this is from the front coming in off from State Street. The very top floor you see was built in a way that it would no longer meet code. So for us, for the current purpose, we would use it as storage because we cannot use it for office space. Knowing that when the agency builds to a size that it no longer fits this building well, we can turn that to meet code, and then with already in the building have room to expand. The first floor there then would be our administrative space. So I took these pictures in the building as it exists today, so there are spots that you're gonna have to go. But remember, we don't own this building, we just took pictures of and dreamed about it. So this is the back side of the building. This would be the lower entrance to the clinical space. The clinical space would be about 12,000 square feet. Our current main office size is about 15,000. So we're going to have almost as much room for clinical programming as we have in our entire main office. It's completely handicap accessible entrance. This is just, I'm trying to give you guys an idea kind of what it looks like. So this is standing inside, just looking out into that back parking lot. This is as you walk in the door. If you were to look to the right, reception desk is there. Where the windows are at the end, that would be the area where all of our teams programming would be. So the team that now is in that one team office. I'll give you a better picture. Where the door opening is on the left, that leads to a group room as well as a couple of offices. This is as you walk in the door and you're looking to the left. At the end of this hall is where our primary group room would be. There are offices on the left and a group room on the right. This is that area that would be the primary group room. We would build a hallway along the right side of that room, so the group room would have its privacy and you would still be able to access the back of the building. This is the other side. This would be if you walk in the door and you look to the right, this is the area that we picture the team space being in. So we would build a few offices along the left, but we would have room to do individual meetings as well as large teams types of build-out activities. This is towards the back of the building. We would put a hallway down here too, so you can access both sides of the building, and it would create yet another group room for us. This would be the only one that doesn't have windows. This is what a typical current office space looks like, just so you can get an idea. This is the existing kitchen on the lower level. We do some skill-based teaching, with teaching people how to cook, teaching people how to meal plan. So the kitchen would be used for that, but then we could actually have a break room for both staff and clients. This looks like nothing, but this is probably the area I'm most excited about in the building. One of my dreams has always been for our clients who are unhoused and to give them a safe place to take a shower. So we have talked about a small locker room with shower space. We've also talked about a washer and dryer, because we have a lot of people that just don't have safe, clean places to do that. And then turning the rest of the area really into a wellness space, bringing in treadmills and bicycles yoga mats and that type of thing that can be used both for employee wellness, but certainly using it for and with our clients. Because of the amount of space that this building would provide us, this is our Glenwood office building. It's located near the Rockford Memorial, Rockford Shalande, Rockford Mercy, whatever its name is today. We currently use this for our apartment, what we call our apartment program. The apartment program is staff who work with clients who live independently in the community. They just need a little bit extra support to remain housed, to remain safe. So the staff will check on them weekly, make sure that they're taking their medications as prescribed, getting to doctor's appointments, getting to the grocery store, that type of thing. Because it's really a team-based and a community outreach program, we would move that over to the new building. And then our counseling center that you all helped us purchase and build, we're bursting at the seams already, which I didn't think was going to be possible when we bought that building. So we would turn this and its 8 offices into a Westside Counseling Center. When we look at the statistics for the people that we're serving, a lot of them are coming from the West Side. So we think talking about creating access, that would help with access for counseling services. And I think I did that in less than 10 minutes.
Yeah, you
So-
did. Yeah, any questions? Okay, thank you, Sue.
Absolutely.
Appreciate it very much. Okay, moving on to our action items, I will need a motion to approve the May 2024 meeting minutes.
So moved.
Nothing to report, actually.
Pardon me?
Okay.
Oh, yeah, that's,
Oh, it's fine.
okay. Dick, motion made first, we need a second, okay? All those in favor, please say aye. Opposed, same sign, okay? Moving backwards, because I skipped over the monthly activity report. Jason?
Giving me a minute to catch up.
Yeah,
Well, the big things was the event that we had, the Building Bridges to Recovery community event. It was very well attended, both by the organizations within town, funded organizations that are not funded by the mental health board that also participated. Over 300 attendees of community residents that came, and Brandon Novak just blew me away in terms of what an engaging speaker he was. I mean, it was better than I could have imagined. So I think that was kind of the highlight of the month for me. We have things that are still in process, as you'll see from the activities report, the HIPAA compliant ride share, continuing to work on state coordination with CESA implementation. We'll be attending a statewide workshop next week at the UIC Chicago campus School of Social Work that's going to be facilitating and hosting a number of experts around the state on crisis response services and what are the emerging best practices within the state as we continue to all collectively try to implement the mandates of CESA. So those are the things that are happening, and of course we have the impact report for the second year of programming that has now been completed and published both online and the print versions, which we have laid out. So please take a copy of those if you have not already done so. And if you have community events wherein you'd like us to hand those out, we do have more print copies available.
okay, thank you. Moving on now to another action item, the election of officers. And at this point, I open the floor to nominations.
I'm gonna keep you in the same spot, Mary Ann.
Okay.
That's a nomination. Did you-
That's a nomination.
That's a second.
All right.
You broke, let's fix it.
I'm gonna nominate you back then for
And
second.
we have to
or for
vote.
treasurer. Yes, oh, we have to vote on it.
No, if there are no further nominations.
Oh, any others, please?
I will nominate Mr. Cooner as our distinguished vice chair.
Okay. Are there any other nominations?
Ah, keep you as secretary then, how's that?
Thank you. You're honored.
Okay, and as I said, I will nominate Carrie for our treasurer.
Because you want to see my name on those checks.
Yes.
Oh, yeah, everybody got, that's right.
And
Who wants to check?
not yet.
Yeah, it was for Bill.
Oh, you nominated Bill.
I got
He nominated.
Yeah. Terry,
Carrie did. Okay. Any other nominations? Okay. So we actually can vote on this as a slate since there's one nomination for each position. And this will require a roll call. Okay. All right, Mary Ann Abadi, yes. Dr. Copeland?
Could you read the slate just?
Oh, I'm so sorry. That's very helpful, isn't it? Okay, the slate of officers nominated, Mary Ann Abadi for president, Dick Cooner for vice president, Bill Gorski for secretary, and Terry Giardini for treasurer. So that's what we're voting on. All right, so, again, we'll start over since I didn't announce the slate fully. Mary Ann Abadi, yes, approved. Dr. Copeland,
Yes.
Dr. Giardini,
yes.
Dr. Gorski,
Yes.
Margie Limba,
yes.
Dick Cooner,
Yes.
Tim Neighbors, Mohammed Yunus.
Yes.
All right, and then the third, action item is, 24 special conditions met, FY 24 special conditions.
I think this will be the final one from the last program year. It had just been met kind of as we were wrapping up the program year, and this was from the City of Rockford Impact Program. They have a lot of internal experience already on homeless, houseless outreach, working with that population, but as they wanted to increase the scope of that work to include a mental health component, the board required that they reach some type of partnership with them, whether it's through internal mechanisms or external partnerships, to identify a way to provide appropriate clinical supervision. And so they have done that now through contract with Rosecrans. And so the copy of the contract is included that dictates the terms of how that clinical supervision will be available to those outreach workers should they need it. And we believe that that meets their special condition.
Okay. And since it's under our action item, we will need to have a motion. Is that correct? So, we need a motion.
So moved. Second.
Okay, and second. All right, and for this, we just do it. So for, the motion is first and second, and all those that agree and approve, please say aye.
Aye.
Any opposed? So, all right, moving down to the resolution 2024. X, resolution authorizing funded program budgets update in advance payments for program year 23 and 24.
This program is for the Stepping Stones of Rockford expansion of supervised housing, and that was for the purchase and building of a new facility to expand their supported housing. This was funded for program year 2024, which just ended. They have utilized 82,000 of the full $1.65 million. There was a delay on the project due to finding property that was zoned appropriately for the build. And so what is being requested is an expansion of the timeline for 2 additional years to complete the project. but also to provide them an advance payment. And really the reason for that is more beneficial for us because it was budgeted in this year. And so then to carry that over to the next year, just puts it out of budget. I will say from the experience of having worked with Stepping Stones now on 2 capital projects that have reached completion, the counseling center and also the purchase and rehab of a group home from an existing property. They've shown a lot of competence and capability in executing these projects and have been very ideal in terms of getting us all the paperwork and spending all the funds appropriately and doing the appropriate way of reconciliation on anything that they have previously received advance payment for. So they're available if you have any questions, but that is the context of what is being requested.
Make a motion that we.
To approve the resolution
Right.
authorizing funded program budgets update and advance payment for Stepping Stones for program year 23 and 24.
So the money's already allocated, correct?
Yes,
Okay.
And it's a 2-year extension?
2-year extension to complete the project.
Okay.
so I have a motion, Dr. Gorski, second. Okay, I do need to take roll call for this. Mary Ann Abadi, yes. Dr. Copeland.
Yes.
Dr. Giardini.
Yes.
Dr. Gorski.
Yes.
Dick Hunter.
Yes.
Margie Lindmark. She's gonna abstain. Tim Nevers. Mohammed Yunus.
Yes.
All right, it's approved. Moving on to another resolution, 2024-XX. This resolution authorizes the Winnebago County Community Mental Health Board funding and allocation of special project funds for accelerator award applications. Resolution 2024-XX authorizes the Winnebago County Community Mental Health Board funding and allocation of this special project for Community Foundation of Northern Illinois. This program name is addressed Access and Coordination of Behavioral Health Care. The amount of money is $350,000. The special conditions required for this particular program is that the hired consultant shall be independent of all members, entities, or associations with no conflicts of interest. The second is that all major parties shall share proprietary utilization data with the consultant, such as payer mix, length of stay, diagnosis, wait times, and facility survey data. The third condition is the mental health board shall pay no more than the consulting fee up to the requested amount of $350,000. The fourth condition is 1 or 2 of the community mental health board members shall be members of the committee to select the consultant. So I will need a motion.
There's a second one.
Oh, they do, okay, the second one, for that is approved is Regional Office of Education, and the program name is Safe and Secure Schools, and it was requested $300,000 for this particular program. So I will need a motion. Should I put them all together in one thing? Okay. The Winnebago County Mental Health Board shall not fund the following proposal after review of the application. It is the City of Rockford Mental Health Awareness Program. Rationale for this is that the request does not align with the strategic plan and does not improve system capacity. So I will need a motion for all 3 of these, 2 of which will be funded and 1 is not.
Second.
Dr. Gorski?
Second.
Dr. F, thank you. All right, so again, back to the roll call. Okay, so it's Dr. Copeland.
Yes.
Dr. Jardine,
Yes.
Dr. Gorski,
Yes.
Dick Kunert,
Yes.
Margie Winmar, Tim Neighbors, Mohammed Yunus.
Yes.
Mary Ann Abad, yes. Okay, that resolution is approved as well. Moving down now to our discussion items of the July board meeting.
Sure, so the July board meeting, on its regular schedule would be scheduled for July 3rd. We'll be open, our office, and we are happy to host the meeting. If we're gonna do that, I wanna make sure that board members are gonna be available to attend, so, you can tell me that now, you can tell me that later, if you prefer not to discuss your travel plans publicly, but I am just, I guess, without getting into the details of your personal business, is there anyone that feels that we should reschedule that, or is everyone good with keeping?
Well, how many can attend the board meeting?
Maybe that's another question.
Can.
Can we reschedule?
It's complicated. Prefer not to, but.
But haven't we in the past not met in July just because of this?
We did, last year, we canceled the June and July meeting and hosted a special board meeting that was in between the two dates. And we did the strategic planning for like 4 hours. For this year, what we would have as a normal scheduled item would be the approval of the annual budget and work plan for the next fiscal year. We usually do that in July. If for some reason we are not going to meet quorum in July, we can do it in August, or we can host a special board meeting, but then I need to coordinate many schedules to figure out what date would work for a special board meeting. So just wanted to check in on that.
It seemed like most people raise their hands. If
Yeah.
there's any way possible to get a quorum, I say let's try to go for it.
Okay. Well, we'll keep it, and then if for some reason we find out that we're not going to have a quorum of board members, then we could always reschedule it at a future date.
Okay, thank you. The systems coordination update.
Sure, so there's two reasons for this, and really, by statute, the board is required to do a 3-year strategic plan and to operate according to that 3-year strategic plan. The state statute does dictate that there be an annual process of reviewing that to see if that should be updated. So one of the things I would like to do over the next 3 or 4 board meetings while we have some space and discussion is just to give you an update on our 3 areas of programming, systems coordination, and promotion and awareness. Let you know where we're at on some of those objectives and get your feedback as the board members if there are some things that we need to take a look at for updating before we get to the next 3-year cycle. We do not have to do that. It is kind of an optional thing to do that. We do have to update it every 3 years minimum. I think the timing is also good in the sense that now that the board has made a funding decision on the consultant proposal, I think one of the questions was, what is the role that the mental health board has defined for itself as systems coordination or coordinating entity? And what is the board looking for as it relates to program operators, how they participate in that or how they connect with the board in that? So I wanted to just give you an overview of where we're at and provide an opportunity for discussion on that.
The share screen.
Yeah, let me just. This is. Okay. Has anyone seen this before? This visual? Okay.
No.
So this is the community support system framework, and this is what we've been operating on, the board's been operating on really since the outset. And the community support system is about creating an array of services that allows for people with serious mental illness to live in their community. That's the essence of its original research basis. Over the years, it has been modified and adopted to also include additional target populations for which it was not originally developed, but for which it fits nicely. When I was, if you remember, one of the first presentations I gave to the Mental Health Board before Region 1 started doing the planning and all those things, I was facilitating the Youth Mental Health System of Care Collaborative Group, and we were presenting to the board the findings of our work. And one of the things we wrestled with in that group was, do we use a different conceptual model for youth that was coming out of the research for youth systems of care? And what we decided as a group was that that could be very confusing to have different conceptual models out there, and that we looked at the essence and the core components of the two models. They were the same stuff. They were just branded differently, they were visualized differently, and when we got to the core of it, it was the same core stuff. So when we look at this and we say this is a model that can be used for adults with serious mental illness, it's a model with some modification, can be used for children with serious emotional disturbances, can be used for people with substance use disorders as well. And that's what we've been doing, and it's been working quite well. The community support system research, the most recent, and of course this is after a couple decades of research, so it's not uncommon once a research body has reached its kind of conclusion that it does not continue to publish additional research because it's been kind of accepted as a research-based model. And so the last peer-reviewed journal article that I could find on this model was from 1989. And what it says about the community support system, and I hate when people just read the slides, but I did this intentionally, that I'm going to read some of these items to you, because this is out of a really long publication. And here's the things I want to highlight is what it says. That the community support system requires coordination at various levels of service delivery and government. That it's an organized network of caring and responsible people. That it is flexible and allows for communities to determine how to best organize its components. That it states that states and communities are responsible for the effective use of resources and facilities. And that the components must be organized into a coherent, integrated system. Okay, so that's coherent, like that's consistent with what the board's been doing, what the board's been talking about, what the board's been trying to do. I think the part, we'll just get further into the weeds here, when we talk about how the research defines what a coordinating entity is, and it uses entity and organization somewhat ubiquitously, it kind of even at, in 1989, there was a little back and forth between, is it actually an established organization, or is it some type of other form of, or entity? But the essence of what a coordinating entity is defined as is requiring formal arrangements in a community for planning, developing, financing, coordinating, monitoring, and evaluating services. Does that sound familiar? It sounds like some of the things we're trying to do and some of the things we have been. A managing entity should have broad authority to convene and assure the delivery and coordination of services. I've italicized broad because that's where it gets a little bit less clear, right? How much authority does one entity have? And that a single focal point of authority, responsibility, and accountability, that's how it was envisioned. And that the structure and process must be determined by each state and community. So I think broadly, what we're doing is completely in alignment with the intent of the community support system framework research. I think what was envisioned about a coordinating entity, in its essence, is still what we're trying to establish. But the idea of a single focal point that has the authority, responsibility, and accountability to coordinate all of the services of a community is a little bit more slippery, because you don't have a single payer, and you don't really have one entity that has statutory authority over all of the operators of services, right? So that's where it's a little, while we understand the intent and the essence, and we can try to operate that intent and essence, this model was also assuming that there was going to be a very high level of authority from that coordinating entity, which maybe we haven't seen to its fulfillment a few decades later. And so when we look at all the components that make up a community support system in the community, and we look at how that looks in our community from different sectors, different types of agencies that provide services, from our environmental scan, from government to medical, nonprofit, private practice, schools. And then we look at how that looks in our community. This is from our environmental scan survey of only 50 organizations. That doesn't even represent all the organizations in our community. And you look at the different percentages of services that are offered by different organizations. It's a little bit more, it's complex to coordinate all of this. And then we look at funding types, and we see that even in the organizations that took the time to fill out our environmental scan, less than 50% of them were actually receiving funding from the mental health board. There's a lot of diversity in payer type, and there's a lot of diversity in volume of services. You have really large organizations that are providing high volume, more than 300 clients per year in a particular service area. And you have a number of small volume services that are providing maybe serving 0 to 25 people a year in a particular service type. So from small nonprofits to really large organizations, all of these things increase the complexity of trying to coordinate services across a continuum of care. And then we're looking at population. So you've got all different age brackets and all different, from infant and early childhood all the way up to older adults. And we fund a number of specialty services in this different areas. So I think for all of those reasons that I've mentioned, the complexities of multiple payers, different authorities and statutory authority over different parts of the system, different populations, different volume type, we end up with coordinating network ecosystem that looks a little bit more like this, which is we have multiple groups that are convening to attempt to coordinate different parts of the service delivery. And so all of these are the coordinating networks that I've outlined over the time I've been doing this work that we try to participate in, so we can see a little bit of a window into what each of these entities are doing in their corner of the delivery system. And in some cases, you might look at this and say, well, there needs to be consolidation, and maybe there does in some cases. But in other cases, some of these groups have convened because they have specialty knowledge or a unique identity where they do need to be looking at their part of the world as it relates to coordination of services. I think a good example of this is the Criminal Justice Coordinating Council, their behavioral health multidisciplinary team, which is looking at how mental health services get coordinated across the criminal justice delivery system. And we fund a number of those services, and we participate in that network, and we have good relationships with that network. But I would not necessarily say we're the authority of that network. I would say we are a partner in that network. So this is what it looks like in the current day, and this does not even include all of the state networks that are meeting as well, such as, I did put the CESA group up there, but there's a number of ACMI committees and subcommittees that we try to participate in as well, so we know what's happening at a state level. So what do we do with all? Well, here's what we have. The Mental Health Board has defined what systems coordination means within the purview, I guess, of our corner of the world, and how it relates to the programs we fund and the areas where we have leverage and influence in this community. What the Mental Health Board has defined and has approved in the strategic plan is that it falls into these 4 buckets of access to care, which is about identifying and improving the structural barriers to accessing mental health services. Collaboration and support, which is improving network cohesion and coordination of services among funded programs. The diversity and equity and inclusion to promote cultural competence and cultural humility practices in the mental health system of care. And workforce development, which is about developing and retaining an informed and robust mental health workforce. And what I've highlighted for you in yellow are the areas that we already have started to operate some type of strategy or objective on. And I'm just going to highlight for you a few of those, which is the HIPAA compliant ride share is directly targeted at access to care. This is information coming to us from our programs, from our service providers in Winnebago County saying transportation is still an issue, and some organizations have come and asked for a ban or something through Accelerator, and some need a different type of solution. And so the HIPAA compliant rideshare, which could provide door-to-door transportation for mental health services in Winnebago County, has been identified as one of those potential solutions that can hopefully happen at a system level at scale and reach all of our funded programs and make sure everyone has access to utilize those services. On the collaboration and support, as I mentioned, we participate with ACMI. We've been very involved with the CESA committees at the state level. I mentioned to you the UIC workshop that I'm going to next week that is critically important to our local ecosystem. It's critically important to the board as we fund mobile integrated health, behavioral health response, crisis response, 2 of our biggest funded program. That is right at the core of what's happening with CESA, and we need to have a voice as part of that. I see Mary here from the city of Rockford. She's been participating in those networks as well and advocating for what our community needs are as it relates to how this is going to operate from the state. We look at diversity, equity, and inclusion and cultural competence as a specific focus in that. We have begun to survey, and Mark did at our last Learning Network Collaborative, got feedback from all of our funded organizations about what would be the best way that we could provide training that your organizations could access and utilize. And so that's another strategy that we're going to start to mobilize and determine how can we provide that training so that cost is not a barrier for any licensed clinicians in Winnebago County to have access to that. And I believe that's coming down legislatively as a state mandate as well, so we can be ahead of the curve and be prepared for that. And then on workforce development, shouldn't be a surprise that one of our largest funded accelerator awards, a social work opportunities track that is intended to build a social work pathways model. And one of the things that we're looking at that maybe we can have a more direct influence on, aside from that, is a internship stipend program that can coordinate some of the colleges and universities with the clinical services to connect interns to opportunities and make sure that they have some type of financial support for that to make that internship opportunity as high quality as possible and to try to retain that local workforce in our community. So I'm going to stop talking. I know it's a lot of information, but I wanted to let you know how we've defined it, why we've defined it that way, and what we're doing about it. But I'm also open to, as part of our process, continuing to improve that. So I'd love to hear any feedback from the board members.
So if I may, thank you once again for thinking deeply and specifically and comprehensively, about the whole systems piece, and particularly in light of the conversation that took place at the last board meeting around that consultant piece. It seems to me that as we think about moving forward, that there's a couple of different phrases in terms that you use that I think are crucial. One is ecosystem. We talked about that back in '89, perhaps the thinking was a little more rigid and linear. But when you have a complex problem, a complex situation like the one that we have, it's complex and complicated. It's just like doing a space shuttle. I mean, you need the people who work on the guts to work on the guts. You need the people who work on the wings to work on the wings. You need everybody to do their thing. But at some point, everybody needs to come together to understand what we're actually trying to get done. So the other thing that seemed to me stuck out is on one of the slides, you talked about part of the original sort of theory, working theory of the framework was the ability to convene and coordinate. Coordinating part is very complicated and complex, as you just outlined. That's why I think ecosystem is a good word to use to try to figure out that it's not, we don't have like an emperor of mental health. We got a whole lot of systems that are gonna have to learn how to work together. But the convening part is, to me, what seems crucial, because part of the language that was used back in '89 and some of what we've been talking about is authority. And I think that there's different types of authority. And to the extent that because of the way payer systems are set up and the way the governments have to interact and all these other things, there might not be per se some type of hierarchical authority or governmental authority that will make this work, but it's the moral authority and the influence that I think is going to make the difference. And that's where that convening part comes. That there's ways, and you've already shown it, there's ways that we have gotten into other networks to influence, not to have authority over, but to influence, discussion, be aware and all that type of thing. And I think that's sort of the ethos that we're gonna have to have moving forward. That it can't be, to use their terminologies, a governmental entity. It has to be, sort of this, and it's obviously gonna take more than moral authority.
It's client driven. I mean, what we're looking for are agencies that are passionate about doing good things for people. And many of the agencies don't have all the skill sets that are necessary to do this kind of thing of rehabilitation and bring somebody back to where they're at the highest level of social functioning. So we're counting on the fact that they're going to mutually work together.
Yeah.
To do what's best for the client that they say that they honor.
And so to your point, that's the ethos and the ecosystem. I think the culture, I'm sorry, that was the word I was looking for. We have to create the culture.
That's right.
That's where it is, because it can't come necessarily, it can't depend on like a state mandate or something like that. We have to decide, this is the culture, this is how we operate in this community, and use the moral authority that it took to even launch this mental health board.
If I, at the risk of repeating all of Ed's comments, which I couldn't agree with more, first one of which is thank you for this. This is profound and thoughtful and thought-provoking. And I was tracking exactly where you were with coordinating and convening. The thing that hit me like a ton of bricks, and you used the word, I don't see where a coordinating group can have true authority over all those entities in that ecosystem. That one slide where you showed all of our local entities that have their own coordination of their own services. We are here to, in my opinion, based on what's hitting me now, is to coordinate the coordinators. We're sort of here to help convene the coordinators. And the other thing that really isn't mentioned is the funding resources that are provided. With that comes accountability and the ability to influence those entities. So through the power of funding mechanisms, all of these entities that are doing their own bits of coordination, we, I think, have a very unique role to help coordinate the coordinators. That's what struck me. And I might say, the other comment I had is when we think of the consultant time, And a number of us have had conversations about, I know Jason and I have about those special conditions. Really pleased to see them, in particular, that someone from this group, and I'm frankly hoping that Jason also would participate in that consultant selection, because it seems pretty critical to me that consultant is selected from the sea of consultants that would have experience in this area, specific expertise. And there's a lot of healthcare consultants out there, and I don't, even having worked with a bunch of them in my life, I'm not sure which one of them may have exceptional experience in the mental health realm, and I think that's important to have that consultant have that experience.
Right.
Yeah, and furthermore, I think the one emphasis that I would like to see is sustainability.
Yeah.
Because, you know, with accelerator awards, that's a one-time thing.
Yeah.
And for any program to sustain itself, the funding resources are top of mind. And when you get into mental health Medicaid, hopefully you can serve that population with these programs. Then right now, our state is not user-friendly because you have to have 2 assessments. If you have a person duly diagnosed, one with alcoholism or substance use disorder, and the other with mental illness, you have to use 2 assessments, 2 treatment plans to even bill for the individual. So there's a lot of complication in what the consultant is gonna have to look for, Bill.
But we can tell them what to do. We can tell the consultant what our needs are and how we achieve that need. And anyone from outside the system can see without bias. Because we have our own bias. We are too close to the problem to see the real problem. So,
Right.
So if someone comes from outside, set aside, he is going to react differently. Your problem. Right now, as I was discussing before with Dick, that the goal and the vision of the board is to help the people with mental health and substance abuse. But as I'm noticing, we are getting diverted from that. This is not our goal anymore. We are involved in so many programs which is not directly involved with people with mental illness or substance abuse. You are right, we need someone from outside.
So if I may, back to your point, I think on one of those slides, you talked about like sort of the goal, not the goal, but one of the keys of the framework was like responsibility, accountability. But I think you're right, sustainability is one of those values that we need, another one of those words we need to constantly include in whatever it is that we're trying to build with the ecosystem, with the ethos of how we're trying to get things done, the culture we're trying to build. Because back to the point as it relates to the sort of levers of funding and how that can influence things.
The culture is built around the 11 sort of, again, arrived there through research. And the issue that Mohammed's talking about, I mean, I think we have stayed pretty close to, we're being pushed to go into mission driven. But I think honestly, that we have really stayed on fixed on what it is that we said was our mission of serious mental illness, serious emotional disturbance, and addiction. And the outside grants that we have made really have to do with workforce of trying to build the system so that we have workers.
Right.
Because that has been our biggest problem. Is not having the people to do the work that everybody wants to do, but so we've got to get into that.
My only concern is that as a board member, it is our responsibility to make sure that the money, $20 million is a lot of money, that being used effectively.
You bet,
Absolutely,
you bet,
There is a lot of that.
you bet.
that is.
But
Okay,
I think they have done, you know, in fairness to Region One Plan, the systems that Jason has set up in the staff that he's using, I mean, are really absolutely, they're absolutely beautiful in terms of like what they're delivering in the way of accountability.
That's
For,
true.
we really appreciate that.
That's true.
Really appreciate that.
so any other comments or? Okay, we will move on, to other matters. And one thing that I would like to backtrack a little bit, and Margie, I didn't give you the opportunity to introduce yourself and tell the board a little bit about who you are and your background and whatever.
I come from a history of many people in my family with mental health. I don't have I'm not a social worker, and mine is all personal experience. I have passion. My husband is a Winnebago County Board member. I hear his stories when he comes home. I'm very, like I told you before, I may come across as I get involved, I can get very loud, but it's passion, it's not anger. I'm here to learn, and I'm here to hopefully make a difference. And I'm excited that you guys are, that I'm get to be a part of this. I'm at the learning, I'm at the bottom. But, from what I see, and after talking to you, and on a basic term, people have asked me, oh, so what do you do? Is there any explanation as a board member, exactly short of, we review and we decide? But is there any other, as this grows or where you guys are at, from looking from the outside, I think we have to work at, or I see it being worked at, as being more defined. People's positions on the board, because you're gonna grow, so you're gonna take something. My passion is, basically for, I don't know a whole lot about insurance, and I don't know all about that, but I know it's the people that can't afford healthcare. That's where my passion is. So is that something as the board move forward? And I don't know, maybe you guys have done that, but to break out into different areas and bring it back to the board. So where we're covering everything. And, that's just kind of where I'm at, where I'd like to see. I mean, I could be totally wrong, it's all new to me, but,
That's what we think we're doing. Because again, before we existed, there was no money coming from the county into essentially public health, public mental health. Now we have $20 million a year coming into public mental health within Winnebago County, which makes us, at least in our terms, outside of Cook County, I don't know of another county in the state of Illinois that is doing what we're doing.
yeah, I'm not saying we're not
Yeah,
doing.
no,
I don't want to come across that.
Right.
I just say
Yeah,
that,
we want you to hear.
right, but that figuring out into and getting more people, I mean, it's a small board.
Yeah.
And it seems like, mental health is just overrun. So, I look at the size and I look at, and if it's a volunteer, getting more people to help, to do things, to start knowing what it's all about. Because then people go, what is that about? I've had people say, oh, well, what's that percent? I didn't know there was a percent. It's just educating our community.
Mhm.
And that's part of, I think, to Jason's point, why this discussion today was so important about the strategic plan that we have, which outlines exactly what our focus is and why it's that.
Right.
We didn't come up with it just to be doing something. There were environmental scans. We actually went out in the community and had listening sessions and all those types of things to come up with the strategic goals as well as priorities that the community says are the priorities. Things like access.
Right.
And things like transportation and all those other things that are written down in our strategic plan. So that's why this discussion today was so helpful, because part of plan moving forward, as he said, even though we have to do it by statute every 3 years, we're actually ahead of the curve in terms of thinking about things like coordination of services and how we coordinate all those networks that you saw there on the screen. So you're absolutely right. We need
More
part of our, well, we just need more awareness, because the work is getting done. It's just a matter of sometimes the community doesn't get all the information.
And there is a set number of board members in the
By
statute, so.
Well, Margie, I think you're spot on, particularly with your comment about, and Ed has said about access and those who can and cannot access due to coverage, finances. You don't need to know
Right.
anything about the whole insurance game, which is way too complicated. But hopefully Jason or Marianne explained to you about the grant review process, which is a board member you get to do once we get to that part of our year, which is a pretty intense part. But so often in reviewing grants, we're looking at what type of vulnerability is this population confronted with as it relates to the funding of the services that are being provided to them. And in the budgets, we look very carefully at whether or not, could use stepping stones as an example, but there's lots of them. You know, some organizations are able to bill and collect for some of their services, and they're not able to bill and collect for others because of the population they serve. I know when I review them, I take that strongly into consideration, because to serve the entirety, and we know how challenged our community can be, some of our individuals here. So I think I appreciate you making that point. I hope you'll find that that's right up there as it relates to the work we do, is those individuals.
Great segue, because either at our July or August board meeting, our next update area will be on the promotion and awareness. Chelsea will give you an update again of what we're doing, but then we want your feedback on, are there things that we need to improve as we have an opportunity to update our strategic plan. Great.
So I would like to move to adjournment.
Second.
And that's.
What a shot.
Okay, all those in favor, please say aye. Thank you all for.
Yeah.